The best decision I made was to be a respiratory therapist. There's always a purpose, there's always satisfaction. I always leave knowing that I made a difference in somebody's life.
It's a team that takes care of patients, and we are an absolute vital link in this team.
Here at UT Health, we foster an environment that allows the students to know it's an open door policy. You become a family, you become one. You're moving through this process together. You're growing.
Our faculty currently has about 136 years of clinical practice, over 80 years of education, and that makes us unique. That makes us very focused on what we do. We do evidence-based practice, evidence-based education. We want to put out the best, highest level clinicians as we can.
I really have support here, especially like the professors and other classmates, and that's just really encouraging too, because the days are long and things are hard to learn, and so it's really comforting to have that kind of sense of community.
Being located within a health science center is a huge part of who we are. It allows the students the opportunity to collaborate, housed in the same buildings and the same hallways as nursing students, as dental students, as PAs, as MD students.
The clinical rotations start in your first year in your spring semester while you're still in the classroom. It can be a little bit difficult, but it's fun at the same time because you're applying all the knowledge you've learned in the fall semester. And then in your second year is where you get into all the specialty rotations. It includes ECMO, NICU, PICU, sleep lab, pulmonary function testing, and then you also do ICU rotation once more.
You know, not being in the classroom anymore, it's different, it's also exciting, but I think it's where those like Lego pieces of the classroom, of all the courses and facts kind of fit together, and you see the whole picture.
They have contracts all over the nation with different hospitals. So if you're willing to travel to a different state, you can go and do clinical rotation there.
We really get to develop a bond and a connection with our patients. We often have patients that are at their critical point when they need us. We're gonna see patients come in at their worst and we see them leave at their best.
Breathing is the most important and vital part of a person. Our whole job and career focuses on just making sure that the patient survives, that they're breathing, and that they go home back to their family.
One interaction that kind of affirmed my decision was actually one I had in the ICU. I was doing something routine. All of a sudden, family members of the patient start saying, "Oh, thank you so much, we really appreciate it." And it kind of struck me, I was like, wow, you know, I'm just doing this seemingly simple thing, and yet they're just so grateful. It's treating your patients like they're your family, you know, the golden rule, kind of treating other people how you would want to be treated. Getting to really interact with your patient is really what makes healthcare a healing thing.